Did you know that heart disease is the leading cause of death globally, responsible for nearly 18 million deaths each year? That's about 1/3 of all deaths worldwide. But here's the real question. Are you aware of the factors that put you at risk? Today, we're going to reveal the top 10 heart disease risk factors that everyone should know about. Understanding these risks could help you take control of your heart health and potentially save your life. Hello everyone! Welcome back to The Pulse of Life, where we dive deep into health and wellness topics that can transform your life. Today's topic is one that affects millions of people around the world: heart disease. Heart disease can be silent and sneaky, but knowing the risk factors that contribute to it can be a game changer. We'll be uncovering the top 10 risk factors that you need to be aware of, and how you can take steps to reduce your risk and live a healthier, heart-conscious life. Let's jump right into it. 1. High blood pressure, hypertension. Our first risk factor is high blood pressure, also known as hypertension. When your blood pressure is too high, it can damage your arteries, making them less elastic and reducing the flow of blood and oxygen to your heart. This can lead to heart disease, heart attack, and even stroke. Hypertension is often called the silent killer because it doesn't usually have noticeable symptoms. That's why it's crucial to get your blood pressure checked regularly, especially if you're over 40. Tip: to help lower your blood pressure, try reducing your sodium intake, eating more fruits and vegetables, and getting regular exercise. 2. High cholesterol levels. High cholesterol is another major risk factor for heart disease. When you have too much bad cholesterol, LDL, in your blood, it can build up in the walls of your arteries, creating plaques that narrow the arteries and restrict blood flow. This condition is known as atherosclerosis. Over time, atherosclerosis can lead to heart attacks or strokes. It's important to monitor your cholesterol levels and make dietary changes to lower LDL cholesterol while boosting good cholesterol, HDL. Pro tip: incorporate heart-healthy foods like fatty fish, nuts, seeds, and oats into your diet to help maintain healthy cholesterol levels. 3. Smoking. If you're a smoker, listen up. Smoking is one of the most significant contributors to heart disease. Smoking damages the lining of your arteries, leading to the buildup of fatty material, atherosclerosis, and increasing your risk of heart attack and stroke. The good news is that quitting smoking dramatically reduces your risk of heart disease, even if you've been smoking for years. In fact, within a year of quitting, your risk drops by about 50%. Action step: if you smoke, take steps to quit today. Talk to your doctor about smoking cessation programs that can help you on your journey to better heart health. 4. Diabetes. People with diabetes, particularly type 2 diabetes, are at a much higher risk for heart disease. This is because diabetes can damage your blood vessels and the nerves that control your heart. High blood sugar over time can lead to the development of plaques in the arteries, similar to high cholesterol. If you have diabetes, managing your blood sugar levels through diet, exercise, and medication is critical to reducing your risk of heart complications. Pro tip: if you have diabetes, focus on eating a balanced diet rich in whole grains, lean proteins, and healthy fats to keep blood sugar levels stable. 5. Obesity. Being overweight or obese significantly raises your risk of heart disease. Excess weight often leads to other risk factors like high blood pressure, high cholesterol, and diabetes, all of which increase your risk of cardiovascular problems. Losing even a small amount of weight, just 5 to 10% of your body weight, can have a dramatic impact on your heart health. Lifestyle change. Focus on making gradual, sustainable changes to your diet and exercise routine. Every small step counts toward better heart health. 6. Lack of physical activity. One of the most modifiable risk factors for heart disease is physical inactivity. When you're sedentary, your heart has to work harder to pump blood through your body, and this lack of exercise can contribute to weight gain, high blood pressure, and elevated cholesterol levels. Experts recommend at least 150 minutes of moderate intensity exercise per week, which can include activities like brisk walking, cycling, swimming, or even dancing. Challenge: set a goal to move your body every day, even if it's just a 10-minute walk around the block. Regular exercise strengthens your heart and improves your cardiovascular health. 7. Unhealthy diet. A poor diet is a major contributor to heart disease. Diets that are high in processed foods, sugar, saturated fats, and trans fats can increase your risk of developing heart problems. To improve heart health, focus on a diet rich in whole, unprocessed foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Quick tip: adopt a Mediterranean-style diet, which is known to promote heart health. This diet emphasizes olive oil, fish, nuts, and plenty of fresh produce. 8. Excessive alcohol consumption. Drinking too much alcohol can raise your blood pressure and contribute to high cholesterol and obesity, all of which increase your risk for heart disease. Moderation is key. For most people, this means up to 1 drink per day for women and up to 2 drinks per day for men. Healthy alternative. If you enjoy a drink with dinner, consider switching to heart-healthy alternatives like a glass of red wine, which contains antioxidants that may benefit the heart. In moderation, of course. 9. Family history of heart disease. If heart disease runs in your family, your risk may be higher. A family history of heart disease can increase the likelihood that you'll develop it as well, especially if close relatives like your parents or siblings were affected at an early age. While you can't change your genetics, you can manage other risk factors like diet, exercise, and lifestyle choices to reduce your overall risk. Takeaway: if you have a family history of heart disease, make sure to discuss this with your doctor and take extra precautions to monitor your heart health closely. 10. Stress and mental health issues. Chronic stress, as well as mental health conditions like depression and anxiety, can have a significant impact on your heart health. Stress triggers the body's fight or flight response, which raises blood pressure and heart rate, increasing the strain on your heart over time. People under chronic stress may also turn to unhealthy coping mechanisms like overeating, smoking, or drinking, all of which can increase heart disease risk. Self-care tip: practice stress-reducing activities like meditation, yoga, deep breathing, or simply taking time out for yourself. Managing stress is just as important for your heart as managing your physical health. Conclusion: there you have it, the top 10 heart disease risk factors you need to know about. From high blood pressure and smoking to lack of physical activity and family history, each of these factors plays a critical role in determining your heart health. The good news? Many of these risk factors are modifiable, meaning you can take steps to reduce your risk and protect your heart. Whether it's through better diet, regular exercise, quitting smoking, or managing stress, small changes can have a big impact on your heart health. If you found this video informative, make sure to hit the like button and subscribe to our channel for more valuable health insights. Share this video with your friends and family to help them become more aware of the risk factors for heart disease. You could be helping someone take steps toward a healthier life. And now it's your turn. Comment below and tell us which risk factor surprised you the most, or let us know what you're doing to keep your heart healthy. Stay tuned for more videos, and remember, your heart health is in your hands. Make the right choices today for a healthier tomorrow.